And this morning, we're truly honored to have you join us for the second edition of the Mental Health Forum.
I'm so glad this program is holding so we can learn and then know how to go about our mental health.
Mental health is not luxury. Neurodiversity is not a weakness. I actually consider it a superpower. Once you know how to use that superpower, you can channel it into something beyond this world because your brain works different.
As stakeholders, we must continue to work collaboratively and build a society where mental health is treated with the same seriousness and compassion as physical health. We must encourage open conversations, reduce stigma, and ensure that individuals living with neurological development conditions receive the care, support, and opportunities they deserve.
Today's theme is particularly important because it reminds us that mental health conversations must become more inclusive, compassionate, and practical. For many of us who work within the library spaces, forums such as this also equips us with the knowledge and tools to better understand mental health, support our patrons effectively, and even manage our own emotional well-being.
The causes of autism, number one and most important, is genetics. So if you find that a parent, a sibling, or a close relative has autism, there's a pattern that your child could have autism. Number two is toxics, like being exposed to lead, poisons when you are pregnant, pregnancy complications, delayed labor, certain foods you eat when you are pregnant.
A moment they tell you, push, the oxygen supply to the brain of the child ceases so that the child comes out for the oxygen outside. If the child delays in there without coming out, for that particular duration, oxygen to the brain ceases. And when it ceases, it causes a lot of damage to the brain, because don't forget that the child's brain is not all formed before it comes out.
I decided to get to the community, get those people that are overlooked, put them together with the knowledge that I have with special education needs, and then give it to them for free. Because I think basically the reason why most people are not going for assessment and going on with interventions is financial reasons.
Educators would always be prompted because they have a scheme of work they are supposed to make sure that they achieve. They also have things that they have as rubrics to guide them. And when they prompt you as a parent that the child has a need, quickly move on from there, go the step further, seek for that support for the child. And in seeking for that support for the child, that is where you would get to be assessed. You get to have a report. You would get to have recommendations in that report. And those recommendations are what will tell someone that because the child is unable to sit down, because the child is unable to stay focused in class like the other regular education kids, I think this child would benefit from getting some rest breaks. Yes, it is allowed. Even in school, with a report binding that child, the child gets to have all that support.
The first thing for a parent to be able to help their child is acceptance. Being able to accept that my child needs help, and they have done that. And then the second step is being open about it and not worried about what people's gonna say about you, and being confident enough to talk about it and get that help.
A delay does not remove the condition. It simply delays support. So even if you wait 5 years, 10 years, it's not going to change the condition. So the early you notice some of the symptoms, as has been said, he can't sit still, he does things a certain way, it is best to go and take him to therapy.
1 and 5 are critical years of the child. If we get children in this space, we are able to do so much with them. We have children that come to our center that do not talk, and in less than 2 years, they've developed language in terms of speech.
Children with autism don't need to be sent to special schools. They need to be in regular schools. But inside the schools, we need to have teachers that are trained on children with special needs and learning disabilities so that they can be in the classrooms as teaching assistants to create that environment for the children to be accepted.
The child from 0 to 2 years exposed to screen time is going to have neurodevelopmental challenges in his or her brain because the brain is yet developing.
Today's session has been really informative and have learned more about autism and ADHD than I have ever known. This is not just an individual's problem. It is a problem that as a society we should know more about.
One thing I think society should do is to choose love, is to choose empathy over stigma.
This has given me an opportunity to learn so much I didn't know about autism and ADHD, and I must say that this is something that I definitely want to get involved in.
I once again commend Premier Care for organizing this impactful and important forum and for contributing meaningfully to mental health awareness in Ghana.